Hello everybody, my name is Biaina Der Sarkisian and I will be presenting this slide on poor application. So technology has advanced the nursing practice and has provided countless benefits to promoting safe and efficient practice. However, not having appropriate skills or competency in information technology, IT, can impede one's ability to properly utilize technology in nursing. So, an example of not properly utilizing technology in nursing could be not being properly trained in EHR programs, electronic health records program. So, for example, in my hospital, we use Cerner. And when I was first hired, I had a 3-day training course on how to navigate Cerner through knowing how to access patient charts and inputting information. Another example is not knowing how to work new equipment. So to draw another example from the hospital that I work at is that we've recently started using new IV pumps called Alaris, and we had a session of getting ourselves familiarized with this IV pump before even using it with patients. So yes, there's a lot of technology advances that we see throughout nursing, but it is still up to us to double check all the information that we are inputting on charts or the medication dosages that we are typing into the IV pumps. Although these machines are programmed to notify us of some issues or errors that might have been inputted, but mistakes can still occur, and we need to be extra cautious with all of this technology that we use. So my peer in the previous slide discussed about telehealth nursing. I wanted to reiterate the importance of being competent in this area of nursing, because having the necessary skills will allow a better communication with patients about their health. The American Academy of Ambulatory Care Nursing, AAACN, encourages telehealth nurses to become certified in ambulatory nursing through the American Nurses Credentialing Center. AAACN has established competencies and practice standards for telehealth nursing, which include professional experience, interpersonal skills, documentation, continuing education, resource management practice, and administrative issues. Telehealth nursing programs requires nurses to have about 3 to 5 years of clinical experience. And again, it all depends on the program. It could be a little more, it could be a little less. But again, we see the importance of being qualified to perform such a task, because it isn't that you don't necessarily have that one-on-one with your patient in real life. It is behind a screen or on the telephone, and it is very important to be skillful and competent in nursing to be able to communicate in such a way to patients. But there is a downside to relying so heavily on technology, because if there was an event of a power outage, then the issues arise. So in order to follow with this power outage that we might encounter, is that we need to follow hospital protocol, and it is necessary to be knowledgeable in manual data entry. So yes, technology is amazing, is important and crucial for nursing and our nursing practice, but again, we need to be able to manually do data entry. And again, going back to my hospital, we have something called downtime charting, because there have been many times where there has been power outage, and that is what nurses have to rely on is the downtime charting. And then later on, all of that information can be transferred into the computers. Okay, thank you.